Good morning, everyone. Before we begin, can I remind members that social distancing measures are in place in the Chamber and across the Holyrood campus. Please take care to observe these measures over the course of today's business, including when entering and leaving the Chamber. The first item of business is consideration of business motion 23848 in the name of Graham Day, setting out changes to this week's business. And I call on Graham Day to move the motion.
Move, Presiding Officer.
Thank you. No member has asked to speak on the motion, and the question is therefore that motion 23848 be agreed. Are we all agreed? Yes. The motion is therefore agreed. The next item of business is a statement by Jean Freeman on the vaccination plan. The Cabinet Secretary will take questions at the end of her statement, so there should be no interventions or interruptions. And I call on Jean Freeman for up to 15 minutes, please, Cabinet Secretary.
Thank you very much, Presiding Officer. The most recent 7-day rate of COVID-19 cases is 262 per 100,000 and a test positivity rate of 10.1%. Public Health Scotland figures to be released at noon are expected to show that the new variant of concern is increasing in its dominance, and members will recall that it has an increased rate of infection of between 0.4 and 0.7%. So we face a more perilous situation than at any point in this pandemic. And while our NHS is very hard pressed, and yet again we owe a huge debt of gratitude to our NHS and social care staff, we have more at our hand to fight this. In addition to high-level compliance with restrictions and a significantly expanding testing programme with increased capacity and new technologies, we have the National Vaccine Programme, and it is that programme I want to update Parliament on today. Between the 8th of December, when we began the National Vaccination Programme, until the 12th of January, we have given first dose vaccination to just over 80% of care home residents and 55% of care home staff, just under 52% of frontline NHS and social care staff, and in the 8 days since the 4th of January, just over 2% of those aged 80 or over living in the community, a programme that is scaling up rapidly from this week. By the first week in February, we will complete 100% first dose vaccination for all those groups. Overall, a total of 191,965 people have received their first dose of the COVID vaccination, and 2,990 have received their second dose, all of that based on the latest management information as at 8:30 a.m. this morning. We currently have supplies coming through from the 2 authorised vaccines, Pfizer and Oxford AstraZeneca. Our planning scales up delivery, so we are able from February to vaccinate with an average of around 400,000 people a week by the end of that month. The Moderna vaccine is now the 3rd vaccine to be approved, and as with others, we will receive our population share of the supply secured on behalf of the 4 nations by the UK Vaccines Task Force. We currently expect the Moderna vaccine to be available to us from early April, and as before, we will use it in line with advice from the Joint Committee on Vaccines and Immunisation. As members know, the JCVI priority list from those aged 50 upwards reflects the fact that age is the greatest risk factor for serious illness and death from COVID, and represents well over 90% of the preventable mortality from COVID-19 in Scotland. To save lives, particularly in the face of such an infectious new strain, the priority is to vaccinate as many people as quickly as possible. And it was with that in mind, and on reviewing the clinical trial data, that the advice was given to prioritise first doses, providing very high protection with evidence of a minimum 90% vaccine effectiveness from 14 to 21 days after vaccination, and to deliver the second dose within 12 weeks from the first. So our planning has been realigned to do just that. The second dose remains important to lengthen the time immunity is present, and everyone will receive their second dose within 12 weeks of the first, and the second dose will be the same vaccine as the first. As of today, we have a total Scottish allocation of vaccines of 562,125 doses. Of this, 365,000 have arrived in Scottish vaccination centres with boards or GPs. A further 155,025 doses of Pfizer and 42,100 doses of Oxford AstraZeneca are either in transit or in storage at Movianto for Scotland to access. This afternoon, I will publish our deployment plan, setting out more detail. The plan will be updated as we go through the weeks ahead, and I will continue to update members. But based on the supply to date and the plans underway for workforce and vaccine locations, I want to set out some of that detail now. By the first week in February, all JCVI priority groups 1 and 2, that's residents in care homes for older adults, care home staff, frontline health and social care staff, and those aged 80 and over living in the community, will have received their first vaccine dose. With the level of vaccine stock we know we have now and projected deliveries over the next few weeks, beginning in February, we will then vaccinate people aged 70 and over by mid-February, and those aged 65 and those who are clinically extremely vulnerable by the beginning of March. In all, this covers JCVI priority groups 1 to 5, a total of just over 1.4 million eligible individuals vaccinated with the first dose. The second dose vaccination will run in parallel starting from the end of February, and our current modelling on required supply indicates that we will be delivering around 400,000 vaccinations a week from the end of February. Over the course of this period, we will use a range of different settings to deliver the vaccine. From care homes themselves for residents and staff to GP practices, health centres and local clinics, primarily for those aged 80 and over and the clinically extremely vulnerable, to occupational health and vaccination centres for NHS and social care staff. And of course, for those who find it difficult to get to a local centre, we will take the vaccination to them in their home. As we go through February and into March, more local vaccination sites will come on board, community pharmacies, mobile vaccination clinics, small-scale mass vaccination centres and large vaccination centres capable of delivering in excess of 20,000 vaccinations a week in a single location. Some of these large sites have already been secured: Aberdeen Exhibition and Conference Centre, Ravenscraig Sports Facility in Motherwell, Queen Margaret University in Musselburgh and the Edinburgh International Conference Centre. Right now, the NHS Louisa Jordan is, amongst other work, also acting as a vaccination centre, but rapid work is underway to secure more sites across Greater Glasgow and Clyde area, and in the weeks ahead I will provide members and the public with updates to the location map that is in today's deployment plan. As larger numbers become eligible and for whom local travel is easier, the centres are planning initially an 8 a.m. to 8 p.m. opening, but we can extend those hours if that proves more convenient for people. We currently have a team of around 33 military personnel supporting our programme, and I'm pleased that we've now finalised plans to increase this support to our larger centres to provide fast and assured site preparation and ensure the facilities are in place for our mass vaccination centres. Of course, critical to all of this is the workforce, both vaccinators and support staff. The plan to vaccinate 400,000 a week requires a daily workforce capacity of approximately 1,700 whole-time equivalent vaccinators and 950 whole-time equivalent support staff. To achieve that level of vaccinators, we need in headcount 3,400 vaccinators, depending on the proportion of part-time versus full-time staff. We currently have just under 5,500 individual vaccinators registered, not including all participating GPs. In addition to local health board training, over 4,000 have taken part in national training to administer the Pfizer vaccine, and 4,700 have received training on Oxford AstraZeneca. We're continuing to build additional capacity, bringing on board more community health care practitioners, including pharmacists, dentists and optometrists, and are receiving daily offers, which we can now route through our national facility to place them close to where they live and secure the additional training they need. We're also working with the voluntary and community sector to set up a centralised volunteer coordination hub for deployment at mass vaccination centres, making good use of the locally offered support. A number of local and national organisations and businesses have offered to be involved, and our National Contact Facility will also receive those offers from now on and ensure each is considered carefully and used where possible. I'm very grateful indeed to the many individuals, businesses and organisations who have stepped forward so far in this way. Perhaps the most important thing people want to know is when will it be my turn to be vaccinated and how will I be informed? I've given an indication, supplies allowing, of when that will happen in what I've set out so far and in slightly more detail in the deployment plan. If you're in the first two priority groups in terms of how you will be informed, your employer or your health board or your local GP will contact you. If you're in one of the other groups, you will be contacted by letter or phone. If you can't make the date or time you're given, you'll be able to rearrange that, again by phone or online. We've already delivered information to every household in Scotland, and from the 21st of January, a national marketing campaign will kick off. In addition, we'll put out local information through the local press and radio, and of course, continue to use national print and broadcast media to inform a wider public. Members and the wider public can monitor our progress daily and weekly. Daily updates every weekday are published by the Scottish Government on the Scottish Government website, providing the latest cumulative data on the number of people receiving their vaccination. And from today, weekly updates will be published by Public Health Scotland, which provide a more detailed breakdown on priority groups vaccinated and geography. I'll continue to keep members informed, as we have done up to now, through regular letters, detailed information, and responding as quickly as I can to specific questions. I'm also grateful to members for their participation in the briefing we held on January the 4th, and I'm happy, of course, to repeat that if that would be helpful. Presiding Officer, before I end, I want to take this opportunity to recognise the very many NHS staff, Scottish Government officials, armed forces personnel, local authority colleagues and third sector partners who have worked so hard to get us to this stage and continue to do so. And of course, to the many involved at every stage, from vaccine production to procurement to delivery, and all those coming forward volunteering their help. This programme to vaccinate 4.45 million adults in Scotland is a national effort, and each one of them is playing a vital part in that, and they have my very grateful thanks. The vaccine offers us hope, and as we vaccinate more and more of our fellow citizens, that hope becomes more real. But on its own, it won't be enough to win the race against this virus. Each one of us needs to do all we can, following the guidance, abiding closely to restrictions, washing our hands, wearing face coverings, maintaining 2-metre distance from each other, everything we can to slow down the spread of the virus and suppress its prevalence as low as we can, so that increasing vaccination can do the job we need it to do. Doing all of that will protect us, protect the NHS and save lives. Thank you.
The Cabinet Secretary will now take questions on the issues raised in her statement, and we'll allow around 30 minutes for that. It would be helpful if members could press the request to speak buttons if they wish to ask a question, and bear in mind that there are many people who wish to do so, so please be succinct. And I first of all call Donald Cameron.
Can I thank the Cabinet Secretary for advance sight of her statement and offer my thanks to all those involved in this massive national programme. It's clearly welcome that over 190,000 people have received their first dose of the COVID-19 vaccine and some are receiving their second dose. However, it's also clear from the figures that not enough people are being vaccinated each day and that timetables are slipping. And it's particularly worrying that so far we have vaccinated just half of our frontline NHS and social care workforce who are so critical to Scotland overcoming the pandemic. With that in mind, earlier in the week, the Health Secretary and the First Minister indicated that all 4 priority groups would be vaccinated by mid-February. But today's statement leaves out clinically vulnerable people from that group. Can I ask why that is? And secondly, in a recent email to GPs in NHS Lothian, it was indicated that there would be delays to the national booking system, and that may delay in turn the launch of vaccination at large centres by 2 weeks. Can I ask the Health Secretary for an update on this booking system?
Jean Freeman.
Thank you very much. Thank you to Mr Cameron. I don't believe it is the case that timetables are slipping. I think what I have set out in my statement concurs exactly with what we have said before. We started with the JCVI's advice on the most clinically vulnerable, and that is our residents in care homes, the elderly residents in care homes. Inevitably, vaccinating older people in that setting takes longer than a mass vaccination centre of 50 or 60-year-olds or even people as old as me. So we've done what the JCVI says. We're on track to complete all of those priority groups 1 and 2. That's all NHS staff and frontline social care staff by the end of this month, as well as all those 80 and over living in the community and care home residents and staff. That's not a slipping timetable in my book at all. In terms of the delay to the national booking, the email that you referred to, I believe that email was issued by the Local Health and Social Care Partnership. I believe they've now corrected that because the information that they gave was entirely wrong. The national booking system is not delayed. It will be ready. It's being tested towards the end of this week and the beginning of next to make sure that it is absolutely ready and capable of taking the volume of work that it needs to take. And it will be ready from the beginning of February, end of January, beginning of February to do its job. And that job will be that high volume throughput of those in the younger age groups to make sure that we can get them booked to the site that is most convenient for them. For some, that will be their local vaccination clinic. For others, it will be the mobile vaccination units that will be most appropriate. For yet others, it will be either the mini or the mass vaccination sites. And they'll be able to change their booking if the time and date that's given to them isn't convenient. So all of that is on track. And by the end of February into early March, we will have completed first dose vaccination of JCVI priority groups 1 to 5 and will begin the second dose vaccination, running that in parallel.
Monica Lennon.
Thank you, Presiding Officer, and thank you, Cabinet Secretary, for advance sight of the statement. On behalf of Scottish Labour, again, I put in record our thanks to everyone involved in the programme to get Scotland vaccinated. Can I ask how quickly we can move to a 24/7 rollout and how many additional vaccinator and support staff would be needed to implement that across Scotland? People are waiting patiently for the posted to arrive. So can I ask when people over 70 will start to be invited? And how will disabled and older adults who live in their own home, who need the vaccine brought to them, how will they be identified? And will everyone who needs at-home vaccination be guaranteed that? And finally, if I can make a point on behalf of Scotland's home carers, who feel they've been at the bottom of the queue for PPE testing and now the vaccine. And in Lanarkshire, I've had dozens of examples of home carers getting up as early as 4 AM to go online to try and book appointments, but the slots have gone very, very quickly. And we also have NHS staff waiting patiently and going onto the website repeatedly throughout the day. So what more can the Cabinet Secretary say to those workers who are getting a bit frustrated about the booking system, and what confidence can she give them that they will get their appointments very, very soon?
Jean Freeman.
Thanks very much. And there's a number of questions in there. I'll do my best. In terms of how quickly can we go to 24 hours, I would estimate, I mean, once we have the mass sites open and running, we can go to 24 hours. Obviously, that's not something that's possible in a GP practice or a community pharmacy, local clinics perhaps, but certainly the mass sites, that is entirely possible. As we move towards those, which I would anticipate, many are secured already, but I would anticipate in terms of the volume of people and the groups that we want to put through there, for whom that is convenient, that would be end February, early March. I can confirm those dates to Ms Lennon properly after this session. Then, if that is going to work in terms of the volume, then 24 hours is the right way to go. And there is no will to not do that. The will is to do that if that's what it takes, because the objective is to get as many people vaccinated as possible. In terms of the numbers, the 400,000 vaccinations a week is that modelling that takes me to the numbers that I set out in the statement. Again, up to that number, depending on the mix of part-time and full-time, but remembering too that we continue to have people coming forward to register as vaccinators, so the numbers are growing. We currently have enough, even at 400,000 vaccinations a week, but more are coming forward. So we will, I am confident, be able to cope. And of course, with the armed services and the volunteer hub that we're setting up, also those support staff. In terms of over 70s and when will they start to hear, that should be towards the end of this month and then through into February, remembering that we are aiming to vaccinate them, offer them their first appointment for vaccination by the middle of February. For those at home, primarily the identification of people who are housebound or unable easily to get to a local vaccination centre or their primary care practice. That will be identified primarily by the primary care practice. They will know their patients and the patients that district nurses or community nurses visit, for example, and they will be undertaking that vaccination. And yes, they all absolutely should be guaranteed that if they need to be vaccinated at home, they will be vaccinated at home. And your point about home carers and NHS staff, it should be the employers who are contacting people to make sure that they are being given appointments. Often those are in occupational health settings or in those larger vaccination sites that were one of the first things that we set up. But I'm happy to take that away and look at whether there are particular issues within the overall number we've still to vaccinate that we need to resolve. Home carers are harder to reach in that they don't have a single employer. But I'll happily take that away and get back to Ms Lennon with what more we think we can do.
We now move to open questions. I have quite a few. We'll get through them all if we can bear in mind how many there are. Christine Graham, followed by Brian Whittle.
Thank you, Presiding Officer. In the long list of questions by Monica Lennon, she preempted one of mine, but I'll pursue this. Given that home vaccinations of particular relevance in constituencies such as mine, Midlothian and the borders, where we've got sort of remote and isolated communities, people on farms and so on, and note what the Cabinet Secretary said about the GP and district nurse will identify them, but what have not been identified? At what point do they contact the practice or whatever when they've received a letter about their appointment? Because some people may get missed out and they'll be most concerned.
Jean Freeman.
Could I just make the point that home vaccinations are there for people for whom it is very difficult for them to leave home because of their mobility or their health questions, or in some instances because they're elderly and frail. In addition, for constituencies like Ms Graham's and indeed parts of my own, mobile vaccination clinics will be part of the answer in taking vaccination closer to where people are. In terms of people wondering what do I do if I've not heard in time, I think there are two things that they can do. First of all, they can contact that central email that is in the deployment plan. There is a national helpline that can also be phoned, and in addition, they can contact their local GP practice and ask them when they expect to hear from them. That is really what is happening just now with those who are over 80 that are worrying about when they're going to hear, and for others, those other routes are there as well.
Brian Whittle, followed by Fulton McGregor.
Thank you, Deputy Presiding Officer. I wonder if I could ask the Cabinet Secretary if there's any flexibility in the way the vaccines are rolled out. I'm specifically looking again at the difference between rural and urban. For example, if there is somebody in their early 70s with a spouse in their late 60s, that would currently require 2 journeys, or perhaps in a small rural community, could the bands being vaccinated be extended? It kind of speaks to efficiency, and there's a certain logic to that. I wonder if there's any flexibility in the way the vaccines are rolled out.
Jean Freeman.
So the primary purpose, as Mr Whittle knows, and it is worth repeating, is to vaccinate as many of those most at clinical risk of serious illness or death. They're the first priority. That's why JCVI advice goes through the age cohorts, if you like, from elderly right through down to 50 and over. And we need to hold as true to that as we possibly can. However, there are circumstances, and we've had some initial discussions with boards like NHS Highland, for example, where they make the point quite rightly that to send a team to a particular part of their Highland area to do one cohort, bring them back, and then send them back to do the next age group down seems a bit of a waste of resource and time. And so in those instances, discussions board by board with us, we are liable to, or likely to, accord that degree of flexibility to say, if you're going into village X, do everyone there who's over 60, for example, in one shot, because that will be quicker. But we need to get that balance right, because we need to always be confident that we are prioritising the delivery of the first dose to those who are most clinically at risk from this particular virus.
Fulton McGregor and then Jackie Bailey.
Thank you, Presiding Officer. The JCVI priority list sets out frontline healthcare staff rightly as a high priority vaccination. What advice can the Cabinet Secretary offer to staff who support essential frontline NHS activity due to specialist work with vital equipment, for example, but are not themselves NHS staff? And just as a courtesy to let the Cabinet Secretary know that I'm writing to her on behalf of a constituent who falls into exactly this category as a kidney dialysis technician, regularly working in COVID and intensive care wards throughout Scotland.
Jean Freeman.
So there's a thing called the Green Book, which sets out in much more detail what is meant by each of those priority groups. And it is the Green Book against which vaccinators are trained, and it is the Green Book that people work through how to, who's all covered, if you like, by priority 1 or priority 2. I'm going to read briefly from an extract in answer to Mr McGregor's question, because it is important. It is staff who have frequent face-to-face clinical contact with patients who are directly involved in patient care in either secondary or primary care or community settings. They then go on to list a very wide range of professions and activities, and include associated support staff of independent contractors, those working in public, private, third sector and non-standard healthcare settings such as hospices, community-based mental health or addiction services. I will give Mr McGregor that in full, and actually I will include that in full in the letter that we'll issue to MSPs and MPs this afternoon, along with the deployment plan, so that people can see this is a wide definition, and it actually, just so we know, it also says temporary staff, including those working in the vaccination programme, students, trainees, volunteers, agency and bank who are working with patients must also be included.
Jackie Bailey, followed by John McAlpine.
The vaccine rollout is welcome, but as experts tell us, this needs to sit alongside a robust test and trace system. Scotland is testing the least per head of population of any of the 4 UK nations. The capacity is 65,000, but the average testing is about a third of that number. And when you compare the first week in January to the first week in December, there was a 184% increase in positive cases, but only 7% more tests. So testing hasn't been ramped up. And couple that with contact tracing, still relying heavily on text messages, does the Cabinet Secretary believe that this is good enough to help contain the virus?
Jean Freeman.
So a couple of points on that. If the overall thrust of Ms Bailey's question is drawn from what the Right Honourable Gordon Brown said yesterday, I think we dealt with that at the briefing. By and large, it is statistically not credible. However, there are other points in what she said that I want to address. The numbers that she quoted refer to, of course, PCR tests, not those conducted through lateral flow devices, and we're working to make sure that those numbers come through too. It is primarily lateral flow devices backed by PCR that is the central component of our increase in asymptomatic testing, both in care homes but also in communities. We will be coming forward in the next couple of weeks with a further expansion of asymptomatic community testing in order to use that based on the clinical advice I receive in a way that tries to further track down positive cases. But it is undoubtedly true that the PCR numbers that Ms Bailey quotes are not using the full capacity of either the Lighthouse Lab, of which we have a population share in Glasgow, or of the increased NHS PCR processing capacity. That is largely person-driven. So it's people who feel they have symptoms and book a test. They drive the use of that. However, the NHS labs will increase their use as we finish off moving all care home PCR weekly testing to the NHS labs. And part of what we will bring forward is a review that we're doing now about how much more can we proactively use these PCR processing and tests in order to help us. So it will be PCR and asymptomatic in order to chase down more of the virus in particular areas, either where the numbers are stubbornly high, which is what we were doing before Christmas, or where we believe there is inevitably close contact around, for example, some particular employers, where we want to be able to keep testing so that we can help them be sure that their workplace is as safe as it can be.
I'm concerned we won't get through all these questions, so if we could try and have shorter answers, please. Cabinet Secretary. Can I have Joan McAlpin, followed by Alex Cole-Hampton?
Thank you very much. The JVCI advice on vaccination priorities says that the clinically extremely vulnerable group of younger adults will be vaccinated as part of Group 4 at the same time as the over 70s. The Green Book section on COVID was updated last year to include a number of conditions in the clinically extremely vulnerable group who were not previously on the shielded list. For example, adults with Down syndrome who have a mortality rate of COVID 6 times higher than the general population. Can the Cabinet Secretary confirm that everyone listed as clinically extremely vulnerable in the Green Book will be vaccinated in Group 4 at the same time as the over 70s as recommended by the JVCI? And how confident is she that these individuals have all been identified?
Jane Freeman.
Question. In terms of how confident can I be that they've all been identified, our Chief Nursing Officer and our Chief Medical Officer are working right now to make sure that we can find a number of ways to identify and cross-check to make sure that we have found everybody who would fit in that group, but also that if individuals feel that they've been missed out, that they have a really quick route of getting that situation resolved for them, and we will make that clear to members and the wider public as soon as that is resolved, and I hope it will be done very soon. That clinically extremely vulnerable list will be vaccinated within that time frame. And I think we've made that clear. Some of those individuals will fall into more than one category, as I'm sure Ms McAlpine appreciates. So the overall numbers that we are working with that are in the deployment plan are estimated numbers because individuals will fall into more than one category.
Alex Cole-Hamilton, followed by Mark Ruskell.
Thank you very much, Deputy Presiding Officer. Scotland's stockpile of nearly 200,000 doses of vaccine are currently in storage at Movianto. For the benefit of members, Movianto is in Bedford. GP surgeries across Scotland have been given small batches of vaccine and to distribute and told that it will be several weeks before they are given more. A dose of vaccine in a freezer 300 miles away is of no value to a vulnerable Scot waiting immunity. So can I ask the Cabinet Secretary why this isn't in circulation?
Jean Freeman.
So Movianto is the distributor. They bring the vaccines from Haydock through various safety checks to certainly to us in Scotland, and from there on from our vaccination holding centres, which we've spoken about previously. The distribution then goes from there from Movianto around the various parts of the country, including to the islands. The vaccination doses go out on the basis of what each board or GP practice orders and says that they need for any given week. And so they're distributed in that way. In the instance of Pfizer, of course, it has particularly distribution challenges. So we're not stockpiling vaccines. We're not holding them back from vaccinators who are ready to go but can't do anything because they don't have a vaccine dose. And to suggest or imply that is quite wrong. The vaccination doses go out as quickly as we get them to all the places that are currently vaccinating, whether that is teams of NHS staff in care homes or vaccination centres, and now from last week, but ramping up this week and through January, through our GP practices and our local clinics to get to that over 80 age group.
Mark Ruskell, followed by Annabel Ewing.
On the 4th of January, the First Minister said that the government are considering how to prioritise the vaccination of school and childcare staff. And vaccinating these staff after frontline health personnel and high-risk populations could be an important part of any plan to safely and fully reopen schools, and would also be in line with WHO advice. So can the Cabinet Secretary confirm, is it still being considered, and when she will announce plans?
Did you catch the end of that, Cabinet Secretary? No, Mr Ruskell, would it be possible to succinctly repeat the question?
The whole question? I can
no,
just
the last bit.
I'm really looking for an update from Cabinet Secretary about the plans that were committed to on the 4th of February to vaccinate teachers and childcare staff.
Thank you, Mr Ruskell. Jean Freeman.
So the First Minister didn't commit to plans to vaccinate teachers and childcare staff. What she said was that she understood the concern. I'm paraphrasing here, so forgive me if I don't quote exactly. She understood the concerns and that it was a matter that would be continue to be considered. The fact of the matter is that the JCVI advice is crystal clear. It's crystal clear in saying this virus is most serious for those who are older. Age is the highest risk factor. If you vaccinate JCVI priority groups, as they have listed, then you will prevent well over 90% mortality and morbidity in Scotland. If you take any quantum from that group for another group, then there are a group of older adults who you have been told to vaccinate because they're most at risk, that you are delaying their vaccination because you've put the vaccination doses somewhere else. What we have said is that there will be undoubtedly a number of people in the teaching profession, working in schools, working in nurseries, who will be covered by those JCVI priority groups. And therefore, they will be vaccinated in the time frame that we've set out. As JCVI looks beyond its first set of priorities, i.e. those over 50 and upwards, to what we do thereafter, so from the spring onwards, they are considering, not yet determined, whether or not they believe that there are any occupations or other characteristics, for example, BAME and other groups, that we should prioritise within the cohort of 50 to 18. And once they've given us that advice, then we will look at that. And we will continue to consider and see what more we can do to provide assurance to a number of individuals, in particular professional circumstances and work circumstances, where they have concerns about about their vulnerability in this regard.
Annabel Ewing, followed by Annie Wells.
Thank you, Presiding Officer. With a view to providing reassurance to home care workers in my Cowdenbeath constituency, can the Cabinet Secretary confirm that those providing social care out with a home care setting will indeed have priority access to the vaccine? And can the Cabinet Secretary indicate when all those home care workers across Fife and indeed across Scotland may expect to be vaccinated?
Jean Freeman.
So on the latter point, I've said that we will vaccinate those priority, with the first dose, those priority 1 and 2 groups. We have completed that by the end of January. So that takes in the individuals that Ms Ewing is thinking about and talking about. In terms of the particular arrangements and circumstances in Fife, I'm sure Fife Health Board would be happy to provide you with that detail. I certainly can too, and I'm happy to make sure that we send that to you. In terms of social care workers out with a home care setting, I think I know the kind of settings that Ms Ewing is referring to, and where they are client-facing, providing direct care to individuals, and oftentimes very personal care to individuals, so that includes personal assistance and others. Where that is the case, then they are in that priority group, as I've described. And again, if the Green Book, forgive me, I don't know for sure if it does, I suspect it does, if it gives the same kind of definition as it does for NHS or healthcare, frontline healthcare workers, I will make sure that Ms Ewing has sight of that too.
Annie Wells, followed by Anna Sarwar.
Thank you, Presiding Officer. Delivering this vaccine quickly and efficiently is of paramount importance, and companies across Glasgow, including Asda, Brewdog and Rangers Football Club, have all offered to play a part in storing and distributing the vaccine. So can I ask the Cabinet Secretary what action she has taken to work with organisations across civic society who could play a vital part in assisting with this significant challenge?
Jane Freeman.
Thanks very much. Many organisations and indeed individuals have offered support in various ways. The central contact that we've now set up, the email is offersofsupport.vaccine@gov.scotland. That will be where we channel all of those offers. The offers are then, whoever's making the offer is then has a conversation with us. We then pass that on if we believe it can be useful to either a health board or elsewhere in our central team, or indeed in some instances to our colleagues in the armed forces or local authorities to pursue it and take it up. That's how we will take forward all those offers of support from now on.
We're rapidly running out of time here. Anna Sarwar, please.
Thank you, Deputy Presiding Officer. It's clear that the vaccine is the way out of this crisis, and I support the ambition of 400,000 vaccines a week. But to be able to do that, that requires a national effort and national mobilisation. What plans do the government have to engage not just NHS staff, not just the British Army, but also a volunteer army as well? And also how we use mass vaccination centres using, for example, football stadiums, community centres, community hubs and more.
Jane Freeman.
So, as I said in the statement, we are setting up a centralised volunteer coordination hub. We're working with a number of organisations with the networks locally and nationally to help us do that, and that will be precisely to coordinate that volunteer workforce, if you like, locally and nationally to do exactly what Mr Sarwar says. Again, those offers of assistance in terms of hosting, if you like, a mini or a mass vaccination site are being processed through. But in addition, we are actively going out and looking for those in addition to the mass sites that I set out in my statement.
Miles Briggs.
Thank you, Deputy Presiding Officer. It's over 6 weeks since I raised the case of Fred Banning with the First Minister, and I welcome the fact that she has now agreed to meet with him. Can I ask what progress has been made in developing a pathway for terminally ill patients who are desperate to be vaccinated at the earliest opportunity with the vaccine?
Jane Freeman.
So Mr Briggs is correct. First Minister will meet Mr Banning, I think, later this week. I did, as I said I would, I wrote to JCVI. I know my colleague Mr Hancock has done the same. I believe colleagues in Wales and Northern Ireland have also done the same. We have yet to hear from JCVI. We will be back in touch with them again later this week to see if they are any closer to giving us advice. But in the meantime, I've also asked our Chief Medical Officer and his team to consider what their view would be on this matter so that we can try and get a resolution to this as quickly as possible.
Very quickly, please, Ruth Maguire.
Thank you, Presiding Officer. Can I ask the Cabinet Secretary what steps are being taken to ensure that those with communication challenges and folk whose first language is not English do not face inequalities in vaccine access?
Jane Freeman.
So it's a really important point. All the various I can't get the phrase right, but what I mean is the standard communication framework, which I think Ms Maguire will know what I mean by that. All those necessary steps about how we communicate in written terms and by other means are being incorporated, and I know that colleagues centrally are discussing with both British Sign Language but also with interpreters in other languages how might we progress that. And I've actually recently had a letter from a group of interpreters offering their support to help us make sure that we communicate and make as accessible, not just physically, but in all sorts of other ways, this programme, so that we don't miss people out because they can't access a vaccination centre or understand what it is that we're offering.
Thank you. That concludes questions on the Ministerial Statement on the vaccination plans. I'm sorry I was unable to take Rona Mackay and Sarah Boyack. We'll shortly move on to the next item of business.